My name is Dr. Rucker. I'm a plastic surgeon. I've been practicing plastic surgery for the last 30 years. I'm going to talk to you today about breast augmentation and the different types of breast implants that are available. First of all, the first implant that we used primarily approximately 10 years ago was the Saline implant. This implant comes in varying sizes. The difference between this implant and the other implants I'll be showing you are the fact that there's a valve behind this implant. And we connect a tube to it and we can fill this implant up with saline, which is just salt water. That's good because of the fact we can kind of vary the size of the implant by a slight overfill or underfill. There's a downside to this implant though, and that downside is the fact that it does not feel as natural as the other two implants that I'm going to show you and demonstrate for you today. That's one thing, the natural feel. The second thing is that most patients that come to me for breast augmentation are small-breasted, so therefore it's hard to hide an implant behind that small breast. And for that reason, we don't want an implant that you can see through the small breast. Unfortunately, with this implant, I've had several patients go on spring break and come back and say take them out. Why? Because they can see the rippling along the side of the implant on the side of their breast. They don't particularly like that. Another common complaint about this implant is, in my estimation, it does leak a little bit more often than the other two, and I think it's because of the valve itself. So the downsides of the saline, in my estimation, are: one, it's filled with saline; two, you get a little bit more rippling on the side of the implant; and three, it's not as natural by a long shot as compared to the others. The next implant. This implant is a gel-filled implant, a silicone outer covering with a gel inside, silicone gel. The implant was taken off the market in 1992 because of safety reasons. The FDA has repositioned this implant back on the market because of the fact that they made the outside covering thicker and there's less of an incidence of rupture. I use this implant probably 8 out of 10 times that I do a breast augmentation. I like the implant because of the fact that there's no rippling on the side and it's much more natural when compared to the saline implant. Most of my patients today will take a little bit higher risk of a problem with a gel-filled implant because of the natural feel as opposed to the saline. Now, the third implant, which has recently been released and okayed by the FDA, you might have heard it described as the Gummy Bear Implant. This is a cohesive gel. It's basically the same implant as the gel itself, but this gel is cohesive. If it ruptures, it does not leak out like oil. It pushes out in one form and it goes back in if there's a rupture. There's always been a great concern about what happens if this gel leaks. Would it leak throughout my body? Would it get into my tissues? Would it make it more difficult to have the implant removed? Yes. And I think that this implant, which I'm beginning to offer to my patients currently, more or less addresses that concern and solves that concern. Also, some studies seem to indicate that this implant causes less scarring around the implant. So I'm going to try this implant on several of my patients. The FDA says it's a good implant. I think it's just as natural feeling as the other, and with the cohesive gel-like insert or filling, I think this is probably the way to go in the wave of the future. Now, the rate of leakage, I stated before, in my hands I found that the saline probably leaks a little bit more often than the other two implants. I'm often also asked, how long will these implants last? In my estimation, 20 to 30 years. I haven't seen many leakages except the slightly higher rate in the saline implant. Another point to remember, who can receive these implants? Well, I'll tell you, silicone implants, you must be 22 or older in order to get a silicone-filled implant. Finally, how to follow up. And if you're concerned about leakage, how do you monitor your implant? The best way, I think, would be to have an examination by your plastic surgeon who placed the implant every 2 to 3 years. And most of the time, a good examination will more or less give you some idea if you're having, one, any scarring around the implant, or two, any signs of leakage. And signs of leakage would be decreasing size, abnormal shape, some discomfort, some redness of the breast. An examination can usually show through the very thin breast skin that the implant is irregular. Next step would be either mammogram or MRI. And most implant makers that currently sell the silicone implants recommend a MRI every 2 to 3 years to evaluate the implant.